This lecture is going to examine the 5-alpha reductase inhibitors. There's basically two, finasteride and dutasteride. From a mechanistic standpoint, the 5-alpha reductase enzyme is responsible for converting testosterone into its metabolite dihydrotestosterone, or simply DHT. The 5-A reductase enzyme occurs in two isoforms, type 2 isoforms inhibited by finasteride, and dutasteride can also inhibit both type 1 and type 2. Dutasteride would theoretically provide more potent inhibition of DHT production, but at this point it's not yet known if that's majorly or clinically important. So why is DHT a target? Well, DHT itself is a promoting factor for prostate growth. DHT is also associated with malpattern baldness or malpattern hair loss. And DHT can also be a viable target for inhibition in reducing male characteristics to promote feminizing characteristics in trans patients. So from a mechanistic standpoint, we're going to inhibit the conversion of testosterone to dihydrotestosterone. Another distinguishing characteristics of these drugs is that you can call them DHT blockers, and so sometimes you can see these two classes used interchangeably, but the enzyme is the 5-alpha reductase. Giving these drugs achieves both a reduction in the volume of the prostate, but also a reduction in growth of the prostate. So for BPH, we can see these drugs used alone or in combination with alpha-1 blockers. When these drugs are used, they will reduce PSA levels, and theoretically they should not alter testosterone levels much. The main indications, as I alluded to, are for BPH, as well as malpattern hair baldness, or hair loss, hirsutism, and then again, trans patients that are wishing to reduce some male characteristics. The side effects to these drugs are relatively minor. Most patients don't really experience major side effects. The top three are worrisome for men, of course, but the incidence of these side effects are actually quite small. And as I said before, testosterone really isn't affected. So in terms of the mechanism as to where the reduced libido comes from, it's kind of up in the air. Depression has also been reported with these drugs. Hair growth is listed as a side effect. For patients who are not taking it for hair growth, they do experience hair growth in other places outside of the scalp, body hair and so forth. So in some patients don't appreciate that. Also, blood in the urine is possible, as well as gynecomastia. But excuse me, these side effects are typically not often dramatically encountered. The next group of drugs that fit into the BPH treatment paradigm are the phosphodiesterase inhibitors. And the only drug that's actually really been shown to be effective is tadalafil. Recall that the phosphodiesterase inhibitors are drugs that inhibit phosphodiesterase 5, and this enzyme is found in the penis and the corpus cavernosum, platelets, skeletal muscle, smooth muscle, variety of different anatomical sites. Outside of these drugs' traditional use as drugs to combat erectile dysfunction. When these drugs are given, you can see a smooth muscle relaxation occurring. Recall that when phosphodiesterase 5 is inhibited, cyclic GMP is preserved, it's not degraded as shown here, and then cyclic GMP feeds into this PKC pathway, resulting basically in relaxation of vascular smooth muscle. In the context of BPH and its associated symptoms, we can see the clinical use of tadalafil to improve symptoms. And so in patients that have BPH with erectile dysfunction, as well as mild to moderate lower urinary symptoms, tadalafil is actually a pretty decent add-on therapy. It'll improve symptoms. Some studies, however, fail to show statistically significant differences in urine flow, but in a nutshell, basically, erectile dysfunction symptoms as well as BPH treatment both were clinically correlated or positive. The one indication, though, is that, or the one contraindication, I should say, is that patients that are on PDE5 inhibitors, such as tadalafil for BPH, cannot use nitrates, and patients with low kidney function or reduced renal activity should not be giving that drug as well. And so the use of tadalafil in these patients has been demonstrated quite robustly. And so remember that PDE5 inhibitors such as Viagra and Cialis are indicated mainly for erectile dysfunction, but we can use this one drug, tadalafil, for BPH. And they also are quite useful for pulmonary hypertension. Remember, we said anatomically the phosphodiesterase 5 enzyme had a wide tissue distribution outside of the penis. And so you can see smooth muscle relaxation in both the prostate as well as the pulmonary circuit as well. So that's just one added drug that we can add to our arsenal, and a whole bunch of drugs that can be used for BPH.